Padraig O'Sullivan.
Minister, can I first thank you for attending the rare disease event that we had today in the AV room. You're the first Minister for Health that attended one of our meetings, so it was greatly appreciated. And as I said to you afterwards, there's a degree of optimism now amongst the community that hopefully things might improve in the coming years under your stewardship. So we're looking forward to working with you. Can I just remind members today, this week is Rare Disease Week, or Rare Disease Day is actually this Friday, the last day of the month. And I think it's important, we talk about so many constituency items inside here that, there's a large community of rare disease sufferers out there, nearly 500,000 people in this country. And they're a large electorate in their own right. And I think it's important here to acknowledge and speak about the difficulties that they face. So, first of all, Minister, I think one of the first things you did when you were appointed was you published the genomic strategy, or you attended an event anyway, I think, at the launch of it. And I suppose I would view something like that as part of the building blocks about how we get our health system right. The creation of a registrar for not just for people that suffer from rare diseases, but just in terms of developing our e-health strategy and how those critical and fundamental building blocks need to be in place before you do anything else. And I would really urge you to get those building blocks, as I said, right, those fundamentals. The other thing I'd like to raise is again with rare diseases. In the briefing today, we were given submissions that on average it takes up to 6 years to identify for somebody that's suffering from a rare disease to actually be diagnosed. And I suppose that's 6 years of appointments, different examinations possibly, with consultants, GPs, and all that type of stuff contributes to, I suppose, expanding waiting lists, because people are actually on a journey to try and find out what is wrong with them in many cases. So if extra resources are devoted to, I suppose, the identification and the diagnosis of rare diseases in the first place, you'll find that you'll be able to unclog parts of that system, which, as I said, are full of people seeking answers as to what is wrong with them. Fundamental to all this, I think, is access to orphan drugs. And again, I would have spoken to you last or 2 weeks ago about in Ireland how on average it takes anywhere from 500 to 1,000 days to get some of these drugs approved. And again, we're talking about health and people being healthy into the future. Early diagnosis is key. Identification and diagnosis of the diseases is crucial, but also then the treatment, because if many of these people get treated early with the necessary medicines and treatments, we can actually make sure that they're productive members of society, they can continue to work, that they don't require care, that they can reduce the amount of times they have to attend hospital. So for me, I just would like you to look at that piece in its totality, and I know in the programme for government it's there, and I know that you've said you will. I would just urge you, to give it the attention that it deserves. Thank you.